unstoppable vision, the strength born from stillness, the clarity shaped by discipline.
As we get older, sleep no longer feels as simple as it used to. Some nights, the mind stays awake even when the body is tired. Before we begin, if you care about staying healthy, vibrant, and independent well into your golden years, please consider subscribing to our channel and clicking that little notification bell. We share in-depth, practical health tips that doctors are often too busy to mention, and I don't want you to miss a single one. And I have a quick question for you, one I love to ask. Where are you watching from today? Are you in the United States, Canada, the UK, Australia, or somewhere else entirely? Please drop a comment below and let me know where you're from. It truly brightens my day to see how far this wonderful senior health community of ours reaches. Other nights we fall asleep easily, but wake up again in the early morning hours. But improving sleep doesn't always require dramatic changes. Often, it's the small, gentle habits done consistently that help the most. Today, I want to share 7 practical tips that many older adults never hear about, yet they work surprisingly well. Each one is simple, calming, and easy to try tonight. Let's begin with the first one. The first practical habit to focus on is reducing tension around the eyes. Throughout the day, the small muscles responsible for blinking, focusing, and adjusting to light stay active almost non-stop. By evening, the tension can make the brain think it still needs to remain alert. Easing this area helps send the opposite message that visual activity is slowing down and it's safe to transition into rest. A simple way to do this is to warm your hands by rubbing them together for a few seconds. When they feel comfortably warm, place your palms gently over your closed eyes. Hold them there for about 10 to 15 seconds. The warmth helps relax the orbicular muscles around the eyes, which naturally reduces activity in the visual centers of the brain. Once the eyes begin to soften, move your fingertips to the sides of your temples and make slow circular motions. This area is connected to muscles involved in concentration and eye movement, and loosening it helps reduce the mental alertness signal. You can also sweep your fingers once or twice across the forehead to release the small bands of tension that tend to form there during the day. This short routine takes less than a minute, but it helps the nervous system shift away from daytime focus and makes it easier to settle into sleep. Another practical habit that helps the body settle before sleep is applying gentle warmth to the upper face. During the day, the forehead and the muscles around the sinuses tend to tighten from focusing, frowning, or reacting to light. This tension often goes unnoticed, but it can make the brain maintain a level of alertness that interferes with falling asleep. A simple, warm compress can ease that tension quickly. You can soak a small towel in warm water, squeeze out the excess, and place it across the forehead for about a minute. The heat helps loosen the frontalis muscle, which reduces the subtle strain linked to prolonged concentration. After that, moving the towel down to the upper cheeks can help soften the areas connected to sinus pressure. Warmer tissue in this region improves blood flow, allowing the sinuses to feel more open and reducing the slight congestion that many older adults experience at night. Ending by laying the warm towel lightly over closed eyes for a short moment helps calm the surrounding nerves and lowers overall facial tension. These small temperature shifts guide the nervous system toward a calmer state, making it easier for the body to transition into rest without resistance. Another habit that can make a noticeable difference before bedtime is warming the feet. As people age, blood circulation to the hands and feet becomes less efficient. This means the feet often remain cooler than the rest of the body, and cool extremities send a signal to the brain that conditions are not yet ideal for sleep. The body relies on temperature changes, especially in the feet, to decide when it's time to slow down. When the soles begin to warm, the nervous system interprets that shift as a cue to transition into rest. A practical way to support this process is to warm the soles directly. Sitting at the edge of the bed, gently rub the bottoms of your feet together for 20 to 30 seconds. You should feel the skin become slightly warm, which indicates increased activity in the small blood vessels beneath the surface. After that, place your thumbs along the arch of each foot and make slow, steady presses. This region contains nerve endings that influence relaxation, and stimulating them can help reduce the minor restlessness that sometimes appears right before sleep. Once the feet feel warm, put on a pair of soft, loose socks. The goal is not heavy insulation, but simply maintaining the warmth you've created. Warmer feet encourage vasodilation, the widening of blood vessels, which allows the core body temperature to drop gradually. This drop is one of the key physiological triggers that helps the brain shift from wakefulness into the first stages of sleep. Even though this routine is simple, many older adults find that warming the feet consistently and intentionally helps the body settle much faster once they lie down. A common reason older adults struggle to fall asleep is the way the spine, neck, and shoulders settle once they lie down. Even mild tension in these areas can send small signals that keep the nervous system slightly alert. So before choosing a sleep position, it helps to give the spine a moment to reset. A simple way to do this is to stand or sit at the edge of the bed and roll your shoulders backward 3 or 4 times. This motion loosens the muscles across the upper back and reduces the stiffness that builds from sitting or leaning forward during the day. After that, gently draw your chin back, not downward, so the neck lengthens a little. Hold this position for about 5 seconds and then relax. This helps reduce compression in the cervical spine, an area strongly linked to discomfort when lying down. Once the neck and shoulders feel more neutral, lie down and adjust slowly until the spine feels supported. Sleeping on your back is often helpful because it spreads your body weight evenly and reduces pressure on the lower back. If back sleeping isn't comfortable, lying on the left side is a good alternative. This position allows the stomach to sit lower than the esophagus, which can reduce nighttime reflux and make breathing easier. Pay attention to how your neck rests on the pillow. The goal is to keep the neck aligned with the spine, not tilted upward or sinking downward. You can add or remove a small folded towel under the pillow until the height feels right. When the spine is supported and the position suits your body, muscle activity decreases. The nervous system shifts out of guard mode and the body becomes more ready for deeper sleep. For many older adults, a short nap during the day feels necessary, especially when energy levels dip in the afternoon. A brief rest can be helpful, but the length and timing of that nap play a major role in how easily you fall asleep at night. The body maintains something called sleep pressure, a natural buildup of chemicals in the brain, particularly adenosine, that creates the feeling of tiredness. Long or late naps reduce this pressure, leaving the brain less ready for nighttime rest. A practical way to manage this is to limit naps to a controlled window. Aim for 10 to 20 minutes, just enough to lift fatigue without entering deeper sleep stages. If the nap goes past 30 minutes, the brain may enter slow-wave sleep, which resets your sense of tiredness and can delay sleep by hours in the evening. Keeping the nap earlier, ideally before 2 p.m., also helps maintain a consistent rhythm. Late-day napping interferes with the natural rise of melatonin, the hormone responsible for signaling that night is approaching. When you rest, try to nap in a room with soft daylight rather than full darkness. Mild light keeps the brain aware that it is still daytime, reducing the chance of drifting too deeply. If you tend to fall asleep quickly, setting a gentle alarm can help you stay within the ideal range without oversleeping. These small adjustments ensure that your nap refreshes you without interfering with the body's evening routine. When sleep pressure builds naturally through the day, falling asleep at night becomes easier and more predictable. Another practical area that often affects sleep yet gets overlooked is the timing of medications. As the body ages, it processes certain drugs more slowly, which means their effects can last longer than expected. If a medication that increases alertness, boosts heart rate, or stimulates the nervous system is taken too late in the day, it may interfere with the brain's ability to wind down at night. A helpful first step is to review the schedule of your daily medicines rather than the dose itself. Drugs designed to support daytime activity, such as inhalers, stimulants, or medications that improve circulation, are best taken in the morning when the body is naturally more alert. Taking them earlier reduces the chance that their effects will overlap with the hours when the brain needs to transition into a rest state. For anyone taking diuretics, timing becomes even more important. These medications increase urine output, and taking them late in the day often leads to multiple nighttime awakenings. Moving the dose to the morning or early afternoon can significantly reduce sleep interruptions. Even supplements like vitamin B complexes or certain herbal blends can increase energy slightly, so they are better avoided in the evening. If you recently added a new medication and notice that sleep feels lighter, more fragmented, or harder to achieve, try keeping a short log for a few nights. Record when you took each medication and how you slept afterward. This simple tracking makes it easier for a doctor or pharmacist to identify whether timing adjustments could help. Small changes in schedule often lead to fewer nighttime disruptions and a more consistent sleep pattern. The last habit focuses on something simple but extremely important: the way your pillow supports your neck. Many older adults continue using the same pillow for years without noticing how much their neck alignment changes over time. When the pillow is too high, it pushes the head forward, tightening the muscles at the base of the skull. When it's too low, the head sinks backward, which strains the upper spine. Both situations keep the nervous system slightly activated, making it difficult to stay asleep. A practical approach is to check your pillow height while lying in your usual sleep position. Your neck should feel straight and level with the rest of your spine, not bent upward or dropped downward. If the pillow feels too flat, adding a folded towel underneath can raise it to a comfortable height. If it feels too tall, removing layers or switching to a thinner pillow may help. The goal is for the head to feel supported without forcing the neck into an unnatural angle. Side sleepers generally need more height because the shoulder creates extra space between the neck and mattress. Back sleepers often need slightly less support, as too much elevation can tilt the chin forward and restrict airflow. Proper alignment helps keep the airway open and reduces muscle strain, both of which contribute to more stable sleep. A good test is to lie still for 10 to 15 seconds and notice whether the neck muscles feel relaxed. When the pillow supports the natural curve of the neck, muscle tension decreases, breathing stays smoother, and the brain receives fewer discomfort signals during the night. These small adjustments often lead to fewer awakenings and a steadier, more comfortable sleep. As you've seen, improving sleep doesn't require dramatic changes. It's a collection of small decisions that work together to support the body in the hours before bed. Relaxing the eye muscles helps calm the visual system. Applying gentle warmth to the forehead and cheeks reduces tension that builds across the day. Warming the feet supports circulation and helps your body shift into the temperature range needed for rest. Preparing the spine before lying down reduces the signals that come from tight muscles in the neck and shoulders. Managing daytime naps keeps your natural sleep pressure strong. Adjusting medication timing prevents unintended stimulation at night, and finding the right pillow position helps keep the airway and neck aligned so your body can stay asleep more easily. Each habit targets a different part of the system that controls sleep. None of them require special tools, and each one works with the body's own physiology. You don't need to use all 7 at once. Choosing even 1 or 2 can create a noticeable change. Sleep becomes easier when we give the body the right conditions, and with these simple adjustments, your nights can gradually grow steadier, deeper, and more restorative.